Morning everybody, good morning. It's Friday. I don't work on Fridays, but I am in clinic at the moment doing a little bit of admin. And I thought, oh my God, still haven't gotten around to talking about the dermal fillers service that I offer. I was in having a very delicious facial with Sharon this morning. You can see dewy skin. And I thought I may as well take the bull by the horns now and get the whole explanation in relation to the dermal filler service that I'm offering now. And it is up and running from Monday. Well, I don't work Mondays, but next week. And I suppose I just want to explain the service that I'm offering here, and so that you know fully what you're buying into, and that you're educated in relation to what dermal fillers are about and what your understanding of it are, and so that we both have a similar vision on what you're looking for. So I have chosen to work with Belotero. There are five products on their list, and I'm starting out with these two, Belotero Revive, which is a skin rejuvenator, and Belotero Volume, which is for those of us who have flat cheeks from the aging process, to fill in the marionette lines here and the nasolabial lines. And I'll talk to you. So I mentioned yesterday that there are two lip products. One of them is Belotero Contour and the other one is Belotero Shape. And I will be starting and am starting with the Belotero Lip Contour, and that's for the vermilion border and to be able to help with the perioral lines, also known as barcode lines. Belotero Lip Volume is not something that I will be offering at the moment, because that's quite specialised in its training and I have to go for further training. I have done the training in it, but I am currently sticking with Revive, Volume and Belotero Lip Contour. So that's what we're starting out with. Now, alrighty, so why did I choose to work with Belotero? And the reason is that it is the gold standard. It's cross-linked hyaluronic acid, and it also contains glycerol, and that's a powerful hydrating agent. And the hyaluronic acid attracts 200 times its weight in water. So between that and the glycerol, moisturizing your skin from within. So hyaluronic acid in Belotero Revive, which I've chosen to use, it's this one here, is yes, it is a filler. You're not filling in anything. You're just placing small pools of it. Usually it's 1 ml on this side and 1 ml on this side. I'll tell you now in a second how it's actually administered. Placed in strategic places so that it settles then into the interstitial cells underneath your skin, because it's dermal, obviously. And that in turn attracts water from your body and resulting in plumping out of the skin. So the consistency of the dermal filler, Belotero Revive, is kind of like runny honey. So the needle is really very tiny. It's you can barely feel it. But it settles into the areas that I map out, and I'll show you now in a second how I map out, that have lost volume, and it stays there for 6 months or more, but the ballpark is usually 6 months. So need to come back to me again for another 6 months. Some people can wait 9 months depending on their skin. So that is a twice a year treatment to not reverse the aging process, and we don't want you looking 20 years younger. It's only a facelift would actually do that. But what it does is that by restoring the volume, that you actually think, oh my God, I once looked like that. And once you reach a certain age, and I'm right now, is that we lose the fat pads in our cheek areas here, and as a result the cheeks get flatter. We use the fat pads, the muscle pads, also not muscle pads, muscle fibers start to shrink as well. But also because of bone density in menopause, that actually lacks bone density as well, flattening the cheeks, and then the skin just falls down. Lost its scaffolding, which is up here. So not only that, but the skin falls down, leading to these jowls that you get here, but it also falls centrally, which creates these nasolabial lines and the marionette lines, and the mouth can become downturned as a result. So when you're lacking volume here on our beautiful cheeks, my job is, if you're looking for volume, to create a little bit more volume up here. It brings the skin back up, and then in turn flattens out and smooths the shadow areas that can occur here. Now, it could be too late for some of you, and you could have a deep groove here and deep grooves there. And then what I would do in that instance is to add a filler in these areas here to help flatten out and smooth those deep grooves. And in doing the cheek sculpting, marionette lines, nasolabial lines and marionette lines, I would use Belotero volume. But back to Revive. Now this is skin rejuvenator. It is a filler without filling anything, and it actually is a skin plumper. It's got glycerol in it, and the reason I started this service is to complement who is next door, Sharon Malone, who is a facialist, and she can get her clients to a certain point with all her facials and her pills and her potions and so on. But there are clients who need that extra help. They need moisturizing from within. Sharon isn't a nurse, and I am, and basically I've done the training in order to be able to do the skin revitalization and rejuvenation, give the skin that nice glow. So this fabulous product treats the early signs of sun damage, a bit late for me because I never used my SPF when I lived in Australia, as well as the signs of aging. It rehydrates dry skin, it improves the elasticity. I've even seen such a change already. Reduces skin pigmentation, discoloration, often caused by the sun exposure. Mostly here at the side of my face. Reduces redness, promotes firmer, springier skin, reduces the superficial fine lines and wrinkles and skin roughness, and it creates a lovely soft texture, and it helps sun damaged skin. Really quite something for a 1 ml injection on either side of your face. It's a tall order, but you get your results in 1 to 2 weeks, and 2 visits a year are necessary to maintain the results as usual, because it's older we're getting, not younger. Right, okay, so back to Belotero Revive. So when you come to us for, or when you make your inquiries, an email is sent out to you with an information pack on what the work's all about. There are certain people who cannot come to have the work done. It's usually pregnancy and anybody who's breastfeeding. The data doesn't say that it's not safe, but the data doesn't say that it is safe either, and it's a contraindication. So therefore, if you are trying to conceive a baby with IVF, you'll be better off not coming to us until you have your baby. Pregnancy is another one, and breastfeeding. So sorry, you are excluded for now. And when you come in to have the work done, you are giving this consent form to fill in. There's about 20 pages here, but we need to make sure that you are safe in order to have the work done. So we usually advise you to arrive 20 minutes before your appointment so that you can fill this out. And we are filling out that medical questionnaire. We put some topical anesthetic on this part of your face so that it is sufficiently numbing you up. So even though the needle is actually quite tiny, I'll show it you in a second, we want you to be as comfortable as possible. And not only do we use topical anesthetic, but you will also be given a ice pack, so that if I'm injecting this side, you can hold the ice pack to this side so that you're happy in the knowledge that it's iced and that you definitely don't feel it. So we then do an assessment of your face, and I do a mapping of the 16 areas that I'm going to inject. So it's usually from the mid-ear across down to the side of the mouth and across here, and we make 16 lines because it's in those 16 little boxes that I will be doing the injections. And that is, so I will use either needle for each of those little boxes, or I will use a cannula whereby I would make one entry point and you would actually push the cannula in on the skin. So there's one entry point, and that means that you don't have to have 16 different needles, but it depends on the decision that we make on the day, depending on your skin. So once we decide to get cracking and rock on, your face is cleaned with Clonakilty, which is an antiseptic solution that I use here. All of our clients will be advised in a pre-treatment email, which will be sent out 2 days beforehand, to come to clinic with no makeup on. And if you can't bear to arrive to clinic with no makeup, you will be expected to remove all of it when you arrive here. So bring your makeup remover that you normally use, or we can give you wipes here. But there's no point in putting topical anesthetic on top of makeup, firstly. And secondly, we need to make sure that we've got an aseptic technique and as clean as field as is possible. So once we decide to do that, your face is cleaned. I've already mentioned that. And I take out, now this is one that I used recently, so I kept it just to show you. It comes in a blister, in its sterile blister pack, and the syringe is in it and it's already preloaded. So these are lower lock, so these are ones that are twistable, and it has to be, the needle has to be changed very frequently because each entry point is a new introduction of any kind of bacteria. So we keep on changing the lower lock needle all the time. A lot of people don't even want or need to know this. But and just say, look, I don't want you to know what you're doing, just do it, and that's fine. Every single one of those blister packs has got the name and the number of the Belotero that was used, and that is actually then put into your notes so that there's flexibility and trackability and so on. So, and here's what I do. Now, if you're squeamish, don't watch the rest of it. All right, so as a client, you will now be sitting backwards on the treatment bed. So for the draw and the consultation, obviously you'll be sitting upwards. We'll have you sitting backwards, and I remove the top off of this. You can barely see the needle, it's so tiny. And what I will do is inject a pool of Belotero Revive into each one of the 16 squares. Use all of the 1 ml on this side, and a different syringe is used for the other side. That's for explanation of volume. I'll talk to you about volume on another day, but for now we're talking about Belotero Revive, and each of those injection sites, it'll be kind of like a tiny pinprick, like you would as if you were getting a vaccination. And the Belotero Revive is injected into. And bear in mind that only 1 ml goes on this side, 1 ml goes on this side. So that 1 ml is divided up between the 16 squares that have been mapped onto your cheeks and to your face here. And each injection kind of gives a tiny little bump, which has gone down in an hour. And then that Belotero Revive, which is now under your skin, pools and flattens over a 2-day period. And then you will see the results practically in 24 hours. Now it settles properly in 2 weeks, but you will see results from 2 days. I've even seen it myself. And because of the consistency of it, now it's like runny honey, as I say, and the needle is so tiny, so I have to push it in here. So because of the consistency of it, it stays where it's pushed. So between all of the 16 squares that are here, it just evens out all of your, from here all the way down and around here, and gives you that gorgeous revived, rejuvenated glow. And from a bride to your granny can have this. It can be also used up here if you want to, but usually clients start with their face on either side, a mil here and a mil here, and then they And then if you want more, you can come back 2 weeks later and you can have it in your forehead if you want to. You can have it all along here if you want to. There's different product use, obviously, and that's the volume, is used for these. Find that they're, it's starting to annoy you now. And then these barcode lines is actually quite specialized, and that actually does lead to some bruising. So you need to sort of plan that one in advance. But there's very, very, very minimal bruising. Most people, I just clean the face and the client is able to go. They can put on their foundation again about 2 hours later. And if there's any bruising that's going to happen, that will happen in 24 hours. If it's very light bruising, you can cover it with foundation the following day. Does bruising happen? Not that often, but it depends on the person's sensitivity and their skin, whether they will bruise or not. We'll give you little tips and tricks beforehand to minimize bruising. Arnica being one, pineapples being another. And if there is going to be bruising, most people just camouflage it while the bruising is going down. It's not as if you're going to look like as if you've been punched by somebody. Not everybody is going to have a bruise-free treatment. Our skin is like a little peach, and peaches bruise. So we never guarantee that you won't bruise, and we try our best to be able to minimize any of that. And okay, so the next question that came in over the last couple of days was the fees. All right, so for Belotero Revive, the fees are $3.50 per syringe, and that's per one. So for one treatment, 2 boxes would be used. So one for this side and one for this side. And that's $3.50. Those of you who are on our wait list, you will be getting yours at a reduced fee until the 31st of January. And then Belotero volume is $450 per 1 ml syringe, and that is also which is used. That is actually quite specialized as well. So we will advise you. So what actually happens when you come in to have your treatment done is that we do a full facial assessment and we make suggestions. You're not going to be pressurized into having anything, but very rarely does anybody leave without having something done. So that's it in a very quick nutshell. So tomorrow I'm back to work and I might get a chance to actually go in more detail in relation to Belotero volume. But either way, when the full facial assessment is, we will make suggestions. And you are not going to be pressurized into having certain things. If your marionette lines are the only things that are bothering you, well then we'll just fill those for you. And if you don't want to have anything else done, we'll just do that. And if you are more interested in long-term looking for sculpting and volume from your cheeks to be able to take the pressure off your marionette lines, well then we'll talk about that another time. And there is a treatment plan made up for you, and you are expected to return every 6 months. And because hyaluronic acid is naturally in our skin anyway, and it breaks down over time a lot slower than most. So finally, the 3 reasons why you might like to use Belotero hyaluronic acid with glycerol as a dermal filler is firstly to restore lost volume to your face, and it happens as we get older because it's older we're getting and not younger. And that gives back the youthful padding that we lose with age as the fat pads do flatten, our cheeks get flatter and they slide south, and hyaluronic acid volume fillers are used for that. Secondly, to enhance the contours of your face, to redefine your cheekbones, your jawline, which is gradually eroded by age-related bone loss from the skull. And to use, thirdly, the collagen stimulating filler, as in Belotero Revive, to encourage the skin tissues to grow more collagen and improve the face that way. Alrighty, I better wrap up. Instagram is going to have a total banger because I've spoken for so long. Anyway, I will record this. I'll put it up on YouTube, and anybody who is looking for the information pack, I will have that on YouTube link and you can actually see from there. All right, have a lovely day, everybody. I'm actually back to work at 7 tomorrow morning here in Clonakilty. It was so cold last night and a really hard frost. So those of you who are travelling to me tomorrow, I gather the cold snap is here to stay, so please take care. There